My name is Abby Robertson. I am a JVU nursing student, and I'm going to be doing a head-to-toe physical assessment on my brother and dear pal, Tyler. Okay. So, Tyler, you have no significant illnesses going on right now. Do you feel like you are in good health?
Yes.
Okay. Are you on any medications?
No.
You have no allergies?
No.
Okay. That means you don't have allergies. I asked that weird. Sorry.
Yeah, that's fine.
Okay. And then as a child, you broke your metatarsals. How did that happen?
That happened playing football. I tried to stiff arm a guy, and my fingers bent backwards, and I broke these two I think these are metacarpals.
Metatarsals. It's okay.
Tarsals are here, aren't they?
Yeah, it's all right.
But yeah, carpals.
Okay. Then they healed nicely.
Yes.
Okay. You broke your humerus bone.
Yes,
doing.
I broke that riding a moped.
Okay.
And I hit a chug hole and tried to catch myself with my arm, and it broke.
So you are very adventurous.
Yes.
You've had 2 concussions.
Yes.
And those are from?
Football.
Okay.
Yeah.
Got it. But there has been no illnesses or sicknesses or symptoms that have carried on?
No.
Okay. As an adult, you broke your hyoid bone?
Yes.
Okay. How did that happen?
That happened because my little sister Emily was pitching, and she pitches pretty fast, about like 50 miles per hour. And my other sister Abigail was batting, and she swung the bat, hit the ball, and the ball went off of her bat and spun straight into my throat.
Oh, okay.
Yes.
That sounds really painful.
It was.
Okay, but you got it taken care of?
Yes.
And no further symptoms?
No.
Okay. And you had Rocky Mountain spotted fever?
Yes.
And when was that?
That was about 8 months ago.
Okay.
Yes.
And you're all good?
As far as I know.
All right. Let's see. You aren't up to date on your flu vaccination, but you have all your other vaccinations that would be necessary for you to go to school or something like that,
Yes.
so that's good. No major medical family history?
Correct.
Okay. And then as far as depression, that is something that a lot of people experience. Would you say that you experience depression? Okay.
Yes.
And how does that affect your activities of your daily life right now?
I try not to let it affect my life and work. I try to leave that at the door. And sometimes it's hard, and it's just, I'm quiet, and I can't really be myself. It makes me not be myself. It makes me nervous, and it affects me throughout the day. It kind of makes me less motivated, and it's just a constant struggle.
Do you think it has a toll on your physical health?
Sometimes when I don't sleep.
Okay. As far as general findings, you experience weakness and fatigue
I think that's from my depression.
related to the lack of sleep. Okay. Now with your skin, you have no rashes, lumps, sores, itching, anything like that. Okay.
No.
No corrective lenses. Your vision is perfect. Hearing problems?
Nope.
Any problems with your nose, your sinuses?
No.
Throat?
No.
Okay. And your neck? Do you ever notice any swollen nodes?
No.
Glands?
Not in the front. I have neck and back pain and things like that, but nothing.
Okay.
No swollen lymph nodes or anything.
Okay. We'll get to the neck and back pain here
Okay.
soon. You don't have a cough?
No.
No chest pain or discomfort?
No.
Okay. And do you have any appetite change?
Not really. Every once in a while, if I'm having a bad day,
Okay.
I get full a lot faster, or I just don't feel like eating.
Okay.
Yeah.
Are your bowel movements regular?
Mhm.
Going to the bathroom regularly? No changes? No alarming symptoms? Okay. Let's see. Do you experience any leg cramps?
Mm-mm.
Okay. Joint pain or joint stiffness?
I don't know if I would call it joint pain, no.
Okay.
Maybe in my feet, a little bit in my ankles.
Okay.
Did you hear that?
Yep.
Yeah.
I did.
That part.
Okay.
Yeah.
No seizures, no numbness or tingling?
No.
Anything like that? Okay. No anemia, or do you bruise easily?
No.
Okay. Do you feel like you get hot or you get cold really easily? Okay. And then we talked about your mental health and depression and anxiety, but no suicide attempts or memory changes. Okay, so looking at your skin, it is tan, it's warm, it's not too dry, not too moist, so your skin's good. I think that also tells about your nutritional status. Do you feel like you eat the proper foods that your body needs?
Mm-hmm.
Okay. Let's see. And then you were able to walk in here instead of on here, so that tells me that you have good mobility. And I saw you walk in, and so your leg muscles, your gait is all good. Full range of motion in your joints. Do you ever feel like you get locked up?
When I have my muscle pain, recently had a pulled muscle from like the bottom of my shoulder blade up to here. I felt when I was moving from left to right with my head, really bad pain, but as far as joints go, none. I have full range.
Okay.
Nothing wrong.
And clearly you're talking to me, so you can articulate words correctly and you're hearing me correctly. What is your weight?
175.
In your height?
Approximately.
Okay.
6'4".
Okay. Now I'm going to take your radial pulse, so we're going to have a 1 minute moment of silence while I sit here and get your heart rate. You can just relax your arm. Okay, your pulse was 70 beats per minute, so that's normal. And then I was also sneaky, and while I got your pulse, I was counting your respirations, and you're breathing 14 breaths a minute, which is good, within the normal range.
Excellent.
Yeah.
I was
Now,
worried about that one.
I'm going to take your blood pressure, so if you wouldn't mind coming over here. So do you know how this works?
I don't know, but I could guess. The air fills into this thing that's on my arm, and it measures the pressure of my blood that is pushing through, trying to push through the air that is pressing up against my veins.
Okay, that's really close. That's a really good guess. So basically, the air actually closes off the vein, the artery, and then it's the artery, not the vein. And then as I release the air, the first sound I hear is the first shot of blood going through, and so that's the first number, and then the last time I hear it is the last number. So it's measuring how much pressure.
Okay.
Does that make sense?
Interesting.
Yeah.
Cool. Learn something new every day.
Yeah. Probably. Okay, that's on. Okay, if you want to just relax, and then uncross your feet if you would. Okay, I got you at 125 over 78. That's a little bit high. I mean, not enough to be worried at all. The perfect range is 120 over 80.
Okay.
So
I'm close.
you're good enough. Yes. And you said you haven't been feeling feverish today.
No.
Okay, so I don't really.
Sweaty palms, but that's it.
Okay. And then, are you feeling any pain right now?
Yes.
Okay, where are you?
Slight discomfort from here to the top of my neck.
Okay.
Yes.
And when did that occur?
About 3 weeks ago, and it is not anywhere near as bad as it is now.
Okay.
I mean, it was way worse 3 weeks ago, and it's not as bad now as it was then.
Okay.
Yes.
So how long does that pain last for?
I mean, when I'm feeling it,
Mm-hmm.
all day.
Okay.
Yeah.
So it's constant, it doesn't
Yeah.
stop. Okay. Would you describe it as an aching pain or a stabbing pain, a dull pain?
Right now, it's like just a dull pain, and if I'm not in a good position, if I'm like this, I'm fine. If I'm like this, I'm fine. But if I go to look at something while I'm driving, if I'm going to look in my mirror or something, it's just a slight feeling of a pull.
Okay.
Yeah.
And then, what do you do to, are there any aggravating factors that make your pain worse?
Sleeping.
Really?
Yeah.
Okay. So you feel, like, does it wake you up in your sleep?
I feel worse in the mornings, and I've been waking up really early.
Okay, so maybe, would you say it's how you're sleeping, not so much the sleep, but maybe your position when you're sleeping?
Yeah, but I can't really find a comfortable position. So
Okay.
I've pretty much in the last 3 weeks slept in probably every position you can, and still wake up feeling
Okay.
kind of.
And has this pain caused any other symptoms? Does it stay central?
Mhm.
Okay. Anything you've done to treat the pain?
When it's really bad, just like hot on and then cold and hot and cold. I've tried a TENS unit and tried to be adjusted, and both times it made me 10 times worse. So just if it's really bad, ice and hot and
Okay.
ice and hot and deal with it.
Okay. And so the severity of the pain, 0 being no pain at all, 10 being the worst pain you've ever felt in your whole life.
At its worst, at its peak, it's about a 7.5, 8.
Okay.
And right now it's probably a 2. It's just discomfort, 1 maybe.
Okay. Now I'm going to be looking at your hands, checking the capillary refill. So basically what I'm doing, I'm pressing down your nails and seeing how fast it fills back up. And that lets me know if you're hydrated or
Okay.
not. And you are, because yours fills up within under 2 seconds.
Okay.
So that's good. Yeah, and your skin, like I said, warm, cool, dry. Skin turgor, so that's when I lift up, how fast it goes back down? Almost immediately. So you have good hydrated skin. Now I'm going to assess your scalp and your hair. Have you had any problems with dandruff, or have you felt any lesions?
Not as long as I wash my hair.
Okay. Yeah. Your hair looks good and healthy and full. Kind of mess it up a little bit. So.
That's fine.
Okay.
I brought a toboggan.
All right.
We can throw that on later.
And I didn't feel any bumps or lesions at all. So, okay. Can you say the letters BMW for me?
BMW.
All right, great. That shows that your cranial nerve 7 is on point.
Excellent.
Okay. Now I'm going to feel for your temporal artery. Oh, yeah, there it is. Okay.
What was the BMW artery?
No, it's not an artery. It's a cranial nerve.
Cranial.
A cranial nerve.
Most
So you
rappers'
being able-
cranial nerve is really good.
That's so great. Okay, would you open and close your mouth for me? Okay. There's a little bit of popping, but not enough to cause any type of alarming. Okay. Now I'm gonna feel your sinuses. Have you felt stopped up at all lately?
Between the weather change sometimes, but not right now.
Okay.
Because that Arkansas weather is very nice.
Yeah, they do not feel swollen or like there's any pressure in there. Also, so you're good. Okay. Now I would ask you to, I'm going to test your visual field, so I'm going to ask you to follow this
Okay.
light. Okay. Okay, great. They're working well. Now, let's see. I'm going to have you just get your eyes fixed on an object, so that can be myself or something past me, and I'm going to see how your pupils dilate. great. And then would you look at this and then look at something far away without moving your head?
Okay, hold on.
I know it's really hard.
It is. Okay.
Okay.
Did I move my head?
Yeah, no, that's great.
Okay.
That just shows that the cranial nerves 3, 4, and 6, which are related to your eyes, they're all working. So you have no problem with your vision. I'm just going to pull down your eyelids and just check out your sclera and your conjunctiva to make sure that there is no inflammation or too much redness. And you haven't experienced any irritation with your eyes, any itchiness? Okay. This is the hardest part of nursing, I promise. Okay. Yeah, pink. Perfect color. They look great. Okay. Basically, I'm not going to use this, but someone, a healthcare provider, could use the ophthalmoscope to actually look into your eyes and see the internal structures of it to see if there would be any problems or irregular findings. But yeah.
That's cool.
So the external ear, do you have any tenderness in your ears at all
No.
when I do this? No?
No.
Okay, and they look good. They line up evenly, slightly above your eye line, so that's a good sign. I'm not going to use the otoscope either, but a healthcare provider could use the otoscope, which has a light. They can look in, they can see your tympanic membrane, and just to assess if it looks normal or not, and just to see the internal structures of the ear. But we're not going to do that today. Now I'm going to test your hearing. So I'm going to just whisper a few words, and you're going to have to repeat them. Okay, while you're covering up this ear. Okay. Okay, what did I say?
You said a hip, a hop, a hippie to the hippity hip hip, a hop and you don't stop a rockin' to the bang bang.
I got it. Good job, good job. Okay. Will you cover up this ear? Penny table chair.
Penny table chair.
Yes, your hearing is great. Okay. And I'm not going to perform this either, but there is a Weber and Rhines test where I could take a tuning fork and basically strike it against my hand and then put it on the top of your head, and you would tell me which side the vibration you hear on the most. And the finding should be you hear it equally on both sides, but that might not be the case. And then the Rhine test is where I would do the same thing. I would strike it against my hand to create vibration, and I would hold it up against your ear, and I would time you to see how long it took for you to stop hearing the vibration. Okay, your nose looks great. Like you said, you don't have any sniffles, anything like that, any irritation, itching ever. Okay, could I have you close one nostril? Take a deep breath in and out. Okay, same thing on the other side. Okay, good stuff. Okay, so could you smile for me so I can assess your teeth and gums? Okay, and then open up and go, ah. Okay. So, yeah, your teeth and gums are in good shape. There's no hyper redness, so no gingivitis. Tonsils are within the normal size that they're supposed to be. So can I go ahead and have you stick out your tongue, move it back and forth, up and down? Okay, good stuff. Your cranial nerve 11 is working.
Excellent.
Aren't you glad about that?
Yeah.
So now I'm going to go into your neck just to check the symmetry of it. If you could just look straight at me. Yeah, neck looks normal. One side is not bigger than the other. I'm going to look for just lymph nodes. Okay, and I'm also going to feel for your trachea. Do you feel any tenderness at all? No. Okay. Now could I have you, see a little swollenness right here. Have you been feeling a little raspy at all? Or like you can feel one coming up?
Not really.
Okay.
No.
Got it. They're just a little bit swollen, not too much. Yeah, I just have minor lymph nodes swollen a little bit, but nothing to be alarmed by. Now I am going to assess your thoracic cage, your chest. So basically Would you take a breath in and out for me? Okay, so it expands symmetrically. Do you feel any tenderness on palpation? Okay, and no protruding bones or cysts or lumps, anything like that. Okay, I am going to listen to your breath sounds now. You could breathe in. Okay, and out. Okay, one more time. Oh, I said one more time. I lied to you. I'm sorry. Okay. Yeah, your breath sounds are good. They're clear bilaterally. I'm going to check for any tenderness back here. So if you wouldn't mind facing that sheet thing, and you can sit up a little bit if you wouldn't mind, and then just tell me if you feel any tenderness. Any tenderness?
A little bit when you do it on the right.
Really?
Yep.
Okay, what was the, what would you say on a scale of 0 to 10?
Oh, 2, 1, 1.
Okay,
Probably.
got it. And you had said that you have some back pain before,
Yeah.
so it's probably just a little bit of soreness. But okay, nothing to be alarmed by, nothing that would cause you to flinch.
Yep.
All right. And okay, now we're going to test your muscle strength. So take my fingers, and you're not going to hurt me. Grip them as tight as you can. Okay, good stuff. So you have full strength. Okay, and no swelling in your epitrochlear nodes. Okay. So I'm not going to do a breast examination because he's a male. That's that.
You're very observant.
Yep. It's one of those qualities. Okay, now I'm going to feel your jugular vein. Yep, it is present. Okay. I'm going to listen to your heart now. If you wouldn't mind, turn up your shirt. Okay. Okay. Your heart sounds are normal. No murmurs, no thrills. Let's see here. If you wouldn't mind laying down now, I'm going to assess your abdomen and listen to your bowel sounds and just check for symmetry and also, yeah. You're going to tell me if it's tender in a second, but after I listen. Okay. Bowel sounds are present and not hyper or hypoactive, so they're good. Now, do you feel any tenderness? No? Okay.
Just
No?
cold. That's
Just
it.
cold. I'm sorry. I should have worn my hands up before I touched it. Okay. I think that you can go ahead and sit up now. Let's see here. Now I'm going to be assessing your lower extremities, your legs and your feet. So basically they're symmetrical. Your skin is dry and warm and tan. I'm going to check for your pulses. So this is, if you would just relax, it's your popliteal pulse. Okay, it's present. And now I'm going to check your posterior tibial. And your dorsal pedis pulse. This one's the hardest to find. There it is. Okay. And now your toes, the capillary flow on your toes, totally normal, good findings. Yeah, and even hair distribution. Okay, oh, I shouldn't have done that yet because I actually need to test the strength in your ankles and feet. So what I'm gonna have you do is I'm gonna have you push down my feet like they're gas pedals. Or push down my hands, sorry, push down my hands like they're gas pedals. Okay, now pull your toes up to yourself. Okay, good stuff. Now would you try to go outward?
One at a time.
Both times, that's totally fine. Okay, good, and inward. Okay, so full strength in your lower extremities. Now I'm going to test for this thing called Babinski sign. Maybe you don't have it.
What is Babinski's?
Your feet are supposed to kind of like, your toes are supposed to curl a little bit. And now I'm going to make sure that you can feel the difference between sharp and soft sensations. So basically, what I'm going to do is take this pen, if I can, that and that. Can you feel a difference between those two? Okay, so I'm going to have you tell me sharp or dull, or sharp or soft. Okay, so will you close your eyes?
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay, great. I'm going to touch your arms.
Okay. Sharp. 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 Dull. Dull. Sharp. Dull.
Great. I'm going to do your hands, if you wouldn't mind putting them out.
Sharp. Dull. Dull. Sharp.
Okay, turn them over.
Dull. Sharp. Sharp. Dull. Sharp.
Good job. Okay, now I'm going to do this in your legs and your feet.
Okay. Sharp. Dull. Sharp. 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 Dull. 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 Sharp.
Great. So you have full sensation. Now, what I'm going to have you do, where you're going to stand up for this, or if you want to just put your arms out to the side and then reach in and touch your nose, one finger to your nose, and just a couple more times. Okay. So you have cerebral function and you're not drunk, so that's wonderful. If you could put your heel on your shin now, just like this.
I don't have very good balance.
You don't have to do it like a yoga pose, just, right in front.
I like here.
Yes, and then the other one. Okay, great. We already tested your Babinski reflex. While you're standing up, I do have to go back and test your reflexes, but while you're standing up, we'll go ahead and have you test your musculoskeletal. So if you could walk this tan portion from heel to toe, and just walk down the tan portion and back. You don't have to do it to full length, but. Okay, great. Could you walk on your tiptoes there? Okay, wonderful. And then come back walking on your heels.
Oh, so
yeah, let's push it up on you. Good stuff. Okay. And we're going to have you do one more test to show that you're working properly. Could you stand while your eyes closed? And I'm just going to assess how much you sway, and just to make sure that you don't fall or trip or anything like that. So just stand with your eyes closed. Okay, great. You have better balance than you thought you did. Now could you do a shallow knee bend just to show me that you can do a squat type of thing. Yep, good stuff.
Shallow enough.
And then I'm also going to assess your spine while you're standing up. So you just want to turn to me so I can feel. Yeah, I don't feel any. Okay.
That way so you can.
I don't feel any curvature, anything protruding. Now, if you could bend down and touch your toes.
I can't really touch my toes.
Okay. Okay. Well, that's good enough. And then could you, so that was flexion, that was going down. Could you hyperextend and just go backwards a little bit? Okay.
Like a Bernie.
Yes. Wonderful. You're good. Okay, and this last thing is just to test your reflexes, and then we'll be done. Okay, so I'm going to check your patellar reflex. Okay, present. Present. It's like calling your name in school. Now I'm going to check your bicep reflex. Okay, you have some movement. Good stuff. And now your tricep reflex, if you would just relax your arm. Okay. I'm going to do your brachioradialis. It's Clinton. Okay, I saw some movement, so you're great. And now the last one is your Achilles. Okay. And do you have any questions for me?
No.
No? Okay, well, you're in great health. I found no irregularities, no irregularities, no abnormal findings. And yeah, that's it.
Excellent.
Thank you.
Thank you.